One is maternal death, of course, and it's quite obvious what maternal death means, but there are different categorizations of the same as well. Now, you would note that it's not just the GTG, but other relevant information which is required to answer your questions have been added here from, say, Strategy resources as well as other talks and as well UK Embrace. So you will find references here to those other things also. So if you need to understand where they are sourced from, these are the resources. Okay, so it's not just the Green Talk guideline being mentioned throughout this, but wherever relevant. Okay, wherever relevant and wherever I felt that it would be easier for you to retain this information in this context, I have tried to add here. So, first and foremost, understand what is maternal collapse, okay, is defined as an acute event involving the cardiorespiratory systems and or the central nervous system, basic outcome of which is that there is reduced or absent consciousness level in the woman. Okay, so we are having altered consciousness in this woman when we are talking about collapse. Now, you need to understand that this is in contradiction to cardiac arrest, okay, and maternal death, of course. So, cardiac arrest is actually when there is cessation of the cardiac activity in a pregnant woman or who has recently delivered. So, the time frame of this is during her pregnancy or up to 6 weeks postnatal, postpartum. Similarly, in maternal death, you also have the same definition going up during the pregnancy, okay, or within the time period of 6 weeks postpartum. How many days is that? 42 days of postnatal period. You would call it as a maternal death. So you need to know about collapse versus cardiac arrest versus maternal death. The reason being, they might ask you these in terms of like your percentages, all right, and the talk articles which came up subsequently, which was about the autopsy in cases of maternal death, and also about the peripartum hysterectomy. They mentioned the different percentages or occurrences of incidences of these things, and they will often refer to as cardiac arrest. All right, so that is different from collapse. We don't nearly are able to calculate our collapse rates, okay, with as much ease because of reporting issues which are there. So the most common cause for collapse, as per your GTG mentioned here, is vasovagal and epilepsy. So either of these options may be mentioned to you. We have seen the single best answers with epilepsy being the highest as one of the options being given. It was just a single best answer, nothing great to uh, take home from there. But you need to remember that the commonest causes are these for in terms of your collapse. Okay, and versus when we talk about mortality rates, and back in the day the questions used to specify what UK embrace time period they used to specify. So it is every 3 years, so you have to know it is triennial, and every triennially they used to give the incidences of the same. So your triennium is the most recent UK embrace that you need to know, and I have mentioned that the incidences also. Does anyone know what is the highest contributor to maternal collapse as of right now, the latest UK embrace? Who is the highest contributor of direct maternal death? Anybody? Guesses are welcome. Eclampsia. Dr. Saiba, eclampsia, really? Okay. Okay.
VT, now VT.
Who said that? Dr. Prabhati. Very good. All right. So it's VT, and you should know a direct indirect and incidental, all of them as well. Okay, and many a times you will be asked to just pick out the right category of maternal death in your question. So that also you have to know. Now, other statistics here from this is the case fatality rate whenever anybody has a cardiac arrest, that is, the heart has stopped beating, not just an altered level of consciousness. So here it may be that the respiratory system, the cardiac system is still functioning, but yet there is reduced consciousness level, or level of oxygenation might be less for her for whatsoever reason, but the other systems may be functional in this, in the definition of a collapse, but in cardiac arrest the heart has essentially stopped. All right, so the other thing is death for you, you know the uh, meaning of that. Obviously it covers any death which is occurring between well within the start of pregnancy till the 6 weeks interval, that you should be aware of. So these percentages not so relevant to you. Maternal mortality was in 2012, 2014 when this GTG was written. This is the incidence. But now for you, more relevantly, whatever is important, I've mentioned subsequently. So this slide, it just tells you, reinforces what I have told you before. Okay. You need to know about the current, that is 2021 to 2023. You can do this with, you don't need to know these values as such, just the bold ones which are we are trying to highlight. Okay, this is for the sake of completion, so this is published in or UK Embrace 2025 source. Okay, for you, you need to understand that the death rate is now is higher than what was in 2012 to 14 triennium, and it is almost reaching 13 per 100,000 women giving birth. Okay, you should also, you can also get these questions which ask you about how many times is it higher in certain groups or populations, and the ethnicity of this is most important, which tells us that it is 2.3 times higher in black women. Similarly, you, Dr. Ankita might have highlighted to you about the ethnicity significance, which is asked in terms of your prematurity, and even for stillbirths for the baby also, that is highlighted in your nice guideline and is a often asked fact for you in the exams. So you should know this. Now, as I asked you, the top leading causes will be asked. So, maternal death 2021 to 23, you should know blood clots, that is thrombosis, thromboembolism is the highest one out here, followed by your heart disease and COVID. COVID has been remaining the same from the previous triennium till now, similar with cause number 2 and cause number 3 as well. You should try and note. But this one is the most important, thrombosis and thromboembolism. Okay, good, Dr. Prabhati. So you've read the UK Embrace then in that case, Prabhati.
Yes.
You've gone through the UK Embrace recent one, I presume, because you
Yes.
knew about this.
Yes. A few months back.
Okay, that's nice. So then we have cause number 4. Now, this used to be leading previously, but a lot of attention and a lot of focus was given to the mental health conditions, and suicide used to be one of the highest ones. The direct, that is resulting from mental health conditions, maternal mental health conditions resulting from pregnancy would be the direct causes. Okay, and then we have epilepsy and stroke as well. If you note here, this is coming under as a lower cause, right? So we don't have blood clots, the highest cause of maternal collapse. If asked, you should note that it would be epilepsy and vasovagal. However, now if we are talking about death, maternal death, then the direct cause for it will be thrombosis, thromboembolism. You should know. Hmm? So the recommendations made by the UK Embrace, just for your reference, not as such askable, but that high risk women should be having urgent referral pathways, and information should be shared about safeguarding and domestic abuse with them, and about discharge summaries, postnatal management plan. That was what, but not important from question perspective. Okay. So this is what it tells you about how what is the numbers which is occurring. Now, just before we go to something which is very often asked and very very important for you to understand, what is a direct maternal death? Direct maternal death. Dr. Babita. Yes. Direct cause. Anybody? Just let's ask Dr. Prabhati. No. All right. Okay, let me highlight that for you. So, a direct cause of a maternal mortality is when the death is from obstetric complications of the pregnant state. So, anything which is caused or exacerbated by your pregnancy, labor, puerperium, or from interventions or omissions or any incorrect treatment or a chain of events resulting from any of these. These are your direct deaths. Okay, so if something resulted in sepsis, all right, like which was from the pregnant state, all right, you operated on an ectopic pregnancy and then subsequently she had a post-operative complication of the same with pelvic sepsis because of some sort of like an abscess or wound infection, whatever it may be, but it was directly related to the pregnancy per se and would not otherwise. So just you need to ask yourself the question, were she would she have succumbed to this were she not pregnant? Right? If your answer is yes, then it's probably not a direct maternal death. If your answer is no, she would not have developed this condition if she was not pregnant, then it is direct maternal death. Okay? Now, coming to indirect maternal death, we have deaths resulting from a previously existing disease or a disease that developed during the pregnancy, okay, but wasn't an obstetric cause directly. Hmm? It could be aggravated by the effect of pregnancy, something like a medical condition which led to the death, like asthma, but the pregnancy contributed to an exacerbation would be indirect. Okay, cardiac disease, but the pregnancy contributed to the exacerbation of the same would be indirect. Okay, then we also have the terminologies which are interchangeable, either coincidental. Okay, coincidental, what is that? Yes, anyone? Prabhati, what did we see just now? Direct is directly caused by the pregnancy, otherwise she did not have that condition. Indirect is something she had but can be worsened or contributed for by the pregnancy. And lastly, coincidental, which is deaths from causes not related to or influenced by the pregnancy at all. Hmm? Then we have a term which is called as late maternal death. What is basically late maternal death is death which occur in a woman who has delivered, but beyond 42-day duration. Okay, so it is not falling within the purview of assessment under audit for UK Embrace directly. Okay, in terms of collecting the maternal mortality data as such, but these women have had some sort of a condition, all right, from either a direct or an indirect obstetric cause, which became protracted, and then after 42 days, but within the year of their delivery, they have succumbed to it. Okay, so this is your definition of a late maternal death. Now, let's see by example. If I were to ask you if it's a postpartum hemorrhage, then what would you categorize it? Quickly, guys, come on. We have a lot to cover, so I need quick responses. Very good. All right. So it would not have otherwise happened, PPH, without a pregnancy, right? So you are straightforward in answering. But if I give you something like sepsis, I'm asking you, she had maternal, I mean, some infection, and a sepsis developed and she died of sepsis. What is the answer then? Yes? Mm-hmm. Mm-hmm. Dr. Babita is like indirect. All right. Mm. Who is agreeing with that? Is it indirect? Is it indirect? The answer is a little bit more complex. Can you see the bars which have two types of stripes here? One is like a solid bar, and then you also have a striped one. All right. Can you see this more carefully? What does it mention? Psychiatric, sepsis, right? So it has both of these. So that means that it's not as straightforward as this. It any sepsis would not directly be indirect or direct. It depends on what it is. All right. So this is your UK embrace directly. So please do not think that I'm misquoting from anywhere. I'm giving you the source from where I have we have taken this. Okay. And you should note that when the sepsis is directly from the genital tract or other pregnancy related infections, then, all right, it is shown in the hatched way here, but you have indirect sepsis also, which can be something like influenza, pneumonia, all right. So if these were there, like for example, if somebody died of COVID, but say they had influenza or they had COVID and developed a sepsis after that, for whatsoever reason, would it be a direct death? No. She could have probably had COVID even outside of pregnancy. So remember that it is scenario specific. Similarly, there is a lot of confusion among students about answering about psychiatric conditions also, which means that if somebody was committed suicide under the influence of drug abuse, alcohol abuse, things that they could have done outside of pregnancy as well, then it becomes indirect. However, if we are talking about women who develop postpartum psychosis or puerperal psychosis, and as a result of that, they committed suicide, that scenario she becomes direct psychiatric cause or direct cause of suicide. So every suicide will not be okay under this. Got it? Got it? So it becomes both in those cases. Thrombosis, thromboembolisms are caused by the pregnancy, so they will be direct causes. Cardiac conditions, other respiratory conditions, as you can see, neurological conditions, okay, other indirect conditions, they are all in solid blocks here. Malignancies are also marked here as a indirect cause, right? Indirect cause here, which is breast, ovary, cervix, all of these. They are being marked as indirect. Is that clear so far? Yeah. Let me show you this in a table which I have written for you with some examples which may come up in your exams as well. So for you to take a look, this is what the definition states. I highlighted what I have emphasized for you as well for a better understanding.